this more recent study that talks very much about the different forms of abuse. So image-based sexual abuse, self-produced child sexual abuse images, non-consensual sexting, online grooming, revenge pornography, sextortion. For me, at the heart of all of this remains one thing that has been an ongoing preoccupation of mine, which is the role that these sexual images play in these crimes. And a discussion that I've already had with Professor Finkelhor about online grooming, I think that a lot of our evidence would show that online grooming is now responsible for the production of some of these images that we are talking about, these images. So we've got, from this online survey, young adults aged 18 to 28, and they're looking at the prevalence rate. And the prevalence rate was nearly 16%, which is quite high in a general population. And that looks very, very similar to other data that we've seen. The more recent data that came out of the Disrupting Harm project would show that there is quite a lot of variation across countries. And that may be the case for lots of different reasons in terms of internet penetration, but also in terms of the willingness in some countries of children to actually disclose in a survey whether or not they've experienced this. What we also know from this particular study is that 13 to 17-year-olds were more likely to be targets across all of these groups, these ones in red, and a larger percentage of perpetrators were peers. And that goes right to the core of some of my concerns, and most of my concerns about technology's responsibility as well. Next slide, please. So what do we know about these victims? I think a lot of the work in this area has focused very much on offenders. Governments have invested quite considerably in offender-related research and in providing prevention programs and treatment programs for offenders. So while we know a lot about victims, there's very a smaller amount of research that actually has victims as the main providers of the information. So we've got this kind of maybe 15 to 16%, but we also know that high-risk populations, for example, children within the care services, still show higher rates than this of offline and online sexual abuse. And we know that early offline sexual abuse still remains the strongest predictor of OCSA. So children who have a history of sexual abuse are more likely than other children to actually go on and be abused online. And they also noted, and we've just heard this from Professor Finkelhor, that when sexual images are involved, the harm is worse. And that's no great surprise to me. If we think about this, these sexual images are very often crime scenes. They are spaces where a crime is being committed against a child. And whether the crime being committed against a child is by a peer or by another adult, they are still images of somebody being sexually abused or sexually exploited. And some of the earliest work in this area also indicated that, for example, when children were confronted by the fact that their images had been seized, very often denied or really did not want to further discuss or disclose any more about the images themselves. They're a source of shame and humiliation. So we know that peer perpetration is just as impactful as where adults are involved. And we know that acquaintance perpetrators are just as impactful as stranger perpetrators. But there is a lot of now evidence of the negative emotional impact that these crimes have on young people. Self-harm, depression and anxiety, self-blame, all feature with this particular population. And what I feel is so disturbing is that it's really unclear what works in terms of prevention or treatment for these victims. This is an area that has remained largely neglected. And I'm going to come back in a little bit to that. But the study by Patterson, I think, was profoundly interesting, because while there is some indication that education programs as they stand, which is not to say they may not be improved, they may not be integrated better into the regular curricula. But where we do have evidence, the education programs maybe change knowledge, sometimes change attitudes, but very rarely actually change behavior. And at the minute, it remains that there are no evidence-based treatment programs for young victims. Next slide, please. Well, we have quite a lot of information about the images themselves. So we have data that has come from both offender studies, and we have data that has come from victim studies, and we have the permanent products of these abuses, which are these images and also text. And this was a study that was done with NCMEC, and we looked at the data. We looked at two databases. So we looked at whether or not there were changes historically in what we saw, and then we looked at a more recent data set. And historically, we now see a trend towards more serious and abusive content. And cases that were actively traded, so ones that showed up in more than 5 particular referrals to NCMEC, were associated with more abusive content, and they were more likely to involve familial offenders, particularly family members. And this is interesting. It's very disturbing, but it's also interesting. We have further data that supports that. Because while we're talking about peer-related violence being serious and impactful, many of the children whose images are highly valued and therefore distributed more widely, in fact, are young children. These children are more likely to have been abused, and photographs taken by, or images or videos taken by family members. And these ones are highly sought after. So we see differences in image distribution and patterns of image creation. And we know that young children, female offenders, more serious content was more likely to involve members of the family. Next slide, please. What we know from I took this data from the most recent report from the Internet Watch Foundation, which is the UK facility to kind of both monitor reports from the general public, but to actively seek out content. And again, very similar to what Professor Finkelhall was talking about, we see an increase in reports that were actioned that involved, and this is really problematic language, self-generated images, largely from people aged 11 to 13, so slightly younger than was in the study from Professor Finkelhall's group. Next slide, please. And also you can see that girls predominantly were in these images. We also looked at the claimed cases from the Interpol database. It came by the UK. So this is a UK sample. It came from work that we did with the National Crime Agency. And we had 687 identified cases. They were individual young people or children. 2/3 female, most of them were white. And we found, where we looked at who had produced the images, that 44% were self-taken images, but the majority of these were taken coercively, either in relationships with adults or with peers. And again, similar to the NCMEC data, family members, 26%, were the next largest category of image producers. Next slide, please. Children under 7, more likely to have been photographed by family members. In the age group 7 to 11, most images were taken by family members or adults who were close to the family. And as children got older, so 12 to 17-year-old, more likely to have self-produced images in a coercive relationship. And I absolutely would agree that not all of these coercive relationships were with adults, but some were. And there were cases that we could not find any coercion for. We had all of the back records and interviews as well as the images. And these tended to be the oldest age group. And in a way, that's no surprise, because who are the adults who create and share most images, sexual images of themselves? They're other young adults. So we've got something there that maybe is not so surprising. Next slide, please. And I think one of the things that we need to be mindful of is that children are not passive recipients in this online space. And in fact, I think the whole way that we think about online, offline is highly problematic. I think it's quite hard to find instances of sexual crimes that do not involve technology at some part in the crime itself. But children are receivers, they're participants, and as we know, they are actors in this digital world. And I think it's interesting that this is being conceptualized as not that the internet makes us more vulnerable, but the suggestion being that it makes already vulnerable children more accessible, and that certainly is the case. And the idea that we really have to start to think again our existing violence frameworks to include online violence if we're going to prevent and manage it. Next slide, please. So the response to the problem, I haven't got time, and I'm probably running over my time now. So I'm hoping that somebody will wave if I start to become problematic. We've got an enormous investment in terms of how we solve this problem. We've got legislation, we have a lot of campaigns. The UK, Germany, I think, has led its way in trying to affect campaigns about changing likely offender behaviour. We have a lot of information about offender interventions. We have victim interventions, some of them highly problematic, I think. And we have police interventions. I haven't got time to talk about all of these, but I'm going to start just with legislation. Next slide, please. And probably it was ICMEC that led the way in trying to push for a global harmonization of laws that related to these images. And I took this from the 9th edition that I think was 2018, which is the most recent one. And there's been enormous progress, absolutely enormous progress in terms of legislation being in place to be able to actually charge and convict people when offending. But we still see that we still have 16 countries who have no legislation, 71 countries who don't have a definition for CSAM. I'm calling it CSAM as opposed to child pornography, which was used in the early editions. I think simply because there has been a move away from that terminology in many countries, not all. 56 countries don't criminalize simple possession. And at the minute, there is a lot of activity going in Japan, again, looking at simple possession and possession also of hentai, so kind of not actual children. And 164 countries don't report suspected CSAM, don't require internet service providers to report suspected CSAM. And this is interesting. It's interesting because that may impact as well on what we know and understand about these offences. Next slide, please. And what we have in the UK is that we have just, after what felt like an eternity, but was really shorter than that, now passed our UK Online Safety Bill. It's finally made it through. I think many of us would feel that it's a watered down version of what had originally been planned, but it's a step forward. And it pushes very hard that social media platforms are mandated to remove illegal content quickly or prevent it from appearing in the first place, prevent children from accessing harmful and age inappropriate content. So some of this legislation relates to online pornography, enforce age limits and age checking measures, ensure risks and dangers posed to children are more transparent, including publishing risk assessments and providing parents and children with clear and accessible ways to report problems online when they do arise. And I know that Professor Finkelhor talked about how few people actually do go on to report, but that is probably a function of the fact that the online reporting systems in most of these instances are opaque, are not immediately responsive, and it's not always clear what the outcome of this is. Please, next slide. What we do have in relation to this online harms bill is that our government monitoring body of communications, Ofcom, will have powers to start to enforce these laws. We are a long way from how that will actually work out in practice. And as all of this has been developing, we see increasing anxieties from governments, and I'm taking this largely from the UK, about how technology is developing at a rate of knots that we can't quite keep up with in terms of child protection. So end-to-end encryption. The UK has just launched in September a public campaign that was really directed at Meta and their bid to move to end-to-end encryption. Excuse me. Effectively, end-to-end encryption is going to reduce the amount of content that is found on Facebook's Meta's platforms, and how that is actually communicated with law enforcement. Forgive me, I have a cold. Forgive me. There are also concerns about age verification. And I've noticed more recently that France now, forgive me, I do apologize. Passed legislation requiring service providers to have strong age verification. Excuse me. We have problems with the darknet, which is end-to-end encrypted by design. We have problems with understanding the impact of extended reality technologies. And we have reports of URLs containing suspected AI-generated child sexual abuse material. Forgive me. Which I can absolutely tell you, a large content of that, part of that, is very difficult to differentiate from actual children being abused. Next slide, please. But in a way, what we failed to do is to try and look more clearly at the concerns of young people. And David Finkelhor talked about the takedown of content. This is one that's from the UK, Report and Remove. I checked their figures, and in fact, there are very few children asking for content to be taken down, in part because they have to produce, or it helps if they can produce the actual images that are being distributed. Take that back to shame and anxieties about other people seeing your images. And it's not so surprising that people do not want to hold on to content that they know has been publicly shared. So, next slide, please. So when we actually talk to young people, we did a consensus study with children as experts. What they're saying is when these cases are identified, or even in terms of education, we need a child-focused approach. We need sensitivity to social and cultural and personal needs of children. We need to understand the tensions between parents, caregivers, professionals, and those who represent the legal process. And these instances need to be managed in a proportionate way.
Ethel, we should probably be wrapping up.
I promise I'm nearly finished. We need to support children through all the elements of this, and we need patience and sensitivity. And maybe one next slide, please. And I promise I've only got one more slide. What we also need are professionals who can work with these children. We have just finished one study that evidenced very clearly that there are no evidence-based guidelines for assessment of interventions. Practitioners are unclear about the nature of the problems, they lack confidence. There's concerns over agency, particularly where you have the possibility of a dual role of victim and perpetrator. And these are rarely covered in training. And that one slide I will finish on, Ernie, the next slide, please. We have currently just finished an efficacy trial of iMinds, which used a mentalization model to try and help young people understand not only their own emotions, which is one thing that, again, David Finkelhood did talk about, but also to try and understand the motivations of other people when they engage online. To date, it's an app, it's a handheld device, they use when they wish, they navigate it when they wish. To date, we have good data that shows that this impacts not only on children's knowledge, but also on children's behavior. I'm not advocating for this particular app. What I am saying is that we have a responsibility towards these children to do more, not only in terms of prevention, but also in terms of intervention. My apologies. And my apologies for coughing all over your presentation. Thank you.
No, thank you for being with us. I was really taken with your comment about how this technology makes vulnerable children more vulnerable. And I think it really sets the stage for doing more. So let's move on to our next panelist. I'm pleased to introduce Dr. Denise Abdou, leader in the field of child abuse. Dr. Abdou is a professor of pediatrics at the University of Colorado School of Medicine, focusing on child abuse and neglect. She built the state's only pediatric sexual assault nurse examiner program. She's recruited, educated, and mentored nurses and developed policies and protocols. She's also a national expert in human trafficking and has led efforts to develop education, risk screening, and clinical care guidelines to improve its recognition, reporting, and management. Dr. Abdou, for physicians, nurses, emergency room personnel, social workers, and others, what have you learned about recognition and response to 21st century child abuse, including the massive problem of child trafficking?
Thank you, Ernie. So we are going to talk a little bit about trafficking and sextortion. And one of the reasons that I think it's important for us to discuss this is because we as healthcare clinicians are not great at recognizing and identifying people who might be trafficked youth or who are utilizing the internet in ways that might be potentially dangerous. So before we talk about the intersectionality of sex trafficking and sextortion, I just want to take a look at some symbols from these popular apps, because this is really important in my world as a healthcare clinician, because these apps are changing rapidly and kids are much more knowledgeable. Adolescents and youth are much more knowledgeable about them than I am. So as we look at these symbols, I hope that some of you recognize some or many of them, but I think about things like Facebook, Instagram, Snapchat, YouTube, Skype, Kik, Twitter, Roblox, Grindr. There's Whisper, WhatsApp, Meet Me, Fortnite. And all of these games and apps literally put kids and millions of others in communication that they would never have communication with previously. And some of these apps, like things like Whisper, are there to act as confessionals for kids. And they connect offenders and youth in 24/7 easy ways. It's convenient. And some of these apps, when they meet an offender, kids quickly move to more discreet apps like Discord and continue conversations there. So in my view, I need to be aware of these to talk to kids about what they mean when they're utilizing them. So just definitionally and quickly to run through this, when we think about trafficking, sex and labor trafficking are important to both recognize, especially in a healthcare setting, because of the implications for ongoing health. And the commercial sexual exploitation of children and child sex trafficking are overlapping terms. Trafficking for sexual purposes, prostitution, sex tourism, youth who engage in survival sex or sex for items that they might want, or youth engaging in sexual acts for money. What's important to remember is that if you are less than 18 in the United States, any of these activities are considered child sexual abuse, and you do not need to prove force, fraud, or coercion. Labor trafficking is when an individual performs labor or other services through the use of force, fraud, and coercion. And examples include things like debt bondage or forced labor, involuntary child labor. Sextortion is different. This is the coercion of minors or youth into sending explicit images or photos and videos of themselves, and then threatening them via blackmail with public release of those images. Currently in the United States, there are no federal sextortion laws, and that has led to statewide disparities in punishments or the sentences for offenders. So a few key points, and we're going to go back and forth between human trafficking and sextortion. Geographic relocation is not always present in trafficked youth. Physical force, abuse, and restraint is also not always present. Any minor involved in prostitution or survival sex is a victim of sex trafficking and child abuse. In the United States, any minor under the age of 18 who's induced to perform commercial sex acts is a victim of human trafficking, regardless of whether or not there's force, fraud, or coercion. And high-risk youth are at particular risk. And people don't disclose medically to us in a clinical setting or to healthcare providers because we don't ask. So a few key points for sextortion. This generally involves an offender interacting with a victim or a youth through an online relationship or through in-person relationships in a digital form, and it's considered teen violence. Youth victims often lose their relationships with family or friends. They may experience behavioral health concerns, just like Dr. Coyle was talking about, including depression and anxiety. They also might experience academic problems like poor academic achievement or truancy. And prevention for clinicians is to think about education for internet safety, app safety, and other resources. So a little bit of epidemiology. When we talk about trafficking, we know that it's estimated between 20 and 40 million people are engaged in modern day slavery. It's estimated that only 0.04% of trafficked persons are identified. And we have a global profit estimated at $150 billion, with 99 billion of that coming from commercial sexual exploitation. Globally, 71% of enslaved people or trafficked people are women and girls, and 29% are men and boys. In 2018, over half of trafficking cases in the United States involved only children. And we know that 12 to 14 is the average age of entry into sex trafficking. What we also know is that 40% of youth entered trafficking at the age of 13 to 14 years, 15% entered at the age of 15 years, and 29% entered at the age of 12 years or younger. So overall, we know that this is early to middle adolescence, which is a great period of time for us to think about preventive efforts. Our 2021 child maltreatment report in the United States notes that there are different patterns of abuse for sex trafficked youth and then for other types of victims of maltreatment. And I think that this is important to think about because oftentimes when we talk about child physical abuse, we talk about very young children or children who are about 0 to 6 years of age. We also know that in other types of child maltreatment, not related to human trafficking, the victims are close to evenly split in terms of sex assigned at birth. With sex trafficking, the majority of trafficked youth, or 87%, are female and about 11.5% are male. Additionally, trafficking happens more in older children. They are the most vulnerable. In 2021, 72% of trafficked youth were between the ages of 14 and 17 years. 22.7%, or almost 23%, were between 9 and 13 years. And 64.6% were females between 14 and 17 years of age. It's important to note, in addition, that 88% of child and adult victims encountered at least one healthcare provider or clinician without being identified as trafficked. And 26% had been seen by a dentist or another healthcare provider. So we know that we are notoriously undertrained to identify trafficked people. Just quickly to think about this again, our average age of entry is 12 to 14 years of age, and we know an average life expectancy after entering trafficking is 7 years. We have an average number of sex partners per year at 868. 68% report being raped while worked, 83% report being threatened with a deadly weapon, 82% report being physically assaulted, and our leading cause of death is HIV and homicide. So when we think about morbidity and mortality in terms of health and wellness, our morbidity and mortality is really poor in trafficked youth, and we need to think about how we can think about prevention and meeting kids where they are. Again, 85% of trafficked persons interface with a medical provider within the first 6 months of being trafficked. And when you stratify that out and look further at the data, most of the people say that they didn't disclose because we as healthcare clinicians didn't ask. So the epidemiology in terms of sextortion is that we know that there's not ideal data on how frequently this happens, and it is reported that over the last 5 years, there's been an almost twofold increase in sextortion cases involving children and adolescents, or those who are less than 18 years of age. Since 2016, the cyber tip line in the United States received over 260,000 reports of online enticement, and that includes the category of sextortion. Between 2019 and 2021, reports involving sextortion more than doubled, and reports from 2022 identify that 79% of offenders were seeking money, which is different than in prior analyses where they were seeking to get explicit child images. In 2021, NCMEC, the National Center for Missing and Exploited Children cyber tip line, received 29.3 million reports of suspected child sexual exploitation. That was increased at a rate of 35% from 2020. So the majority of our sex-torted youth are females, with 78% involving female children. Only 12% involved male children. And in 10% of incidents, child gender was not determined. The average age is 15, so these kids are a little bit older than those entering a trafficked life. And female children ranged from 8 to 17 years of age, and male children 11 to 17 years of age. And there were multi-victim cases. 22% were suspicious of or knew that multiple children were targeted by the same offender. There's a dramatic increase in sextortion of teenage boys, and we know that overseas offenders are representing themselves as teenage girls, and teen boys are susceptible to that enticement. And then there's a demand of money by threat of exposure. In addition to the financial losses, teen victims have committed suicide, attempted suicide, or disclosed that they experienced suicidal ideation as a result of this sextortion. And Snapchat and Instagram account for the majority of social media platforms that are being exploited. So how do youth get involved? Well, in trafficking, the offender is often known to traffic youth, and they often prey on people who are economically or socially vulnerable. Trafficked youths are often groomed while living at home and attending school, and the offender is often a trusted individual in that youth's life. Less than 10% of cases involve kidnapping. For sextortion, this youth get involved by sharing images with someone they know that they might have trusted, or in many cases with someone they met online. Online offenders often target youth and obtain sexual images through debt, through deceit, coercion, or another method. And offenders are often communicating through a fake account, and they might send images to the youth as well through that fake account. So again, when we think about trafficking, we think about force, fraud, and coercion. And in youth, or in the United States, in people who are less than 18 years of age, we don't necessarily need to prove force, fraud, and coercion. For sextortion, I think about tactics, threats, and challenges. And these things include a promise of reciprocity, developing bonds, flattering the youth, accessing accounts and stealing content, and then threatening to send those images to family, friends, and putting them on social media. And then there's a challenge in terms of reporting, because again, in the United States, at the very least, and like what Dr. Coyle showed previously, there aren't unifying laws throughout the world about sextortion and what to do. So for healthcare clinicians, one of the things that I've learned is prevention. We know that asking about some hard things can help us build relationships and bond and trust with the patients that we serve. I think it's our duty to talk about applications, apps, the internet, and what kinds of things people are doing online, and just about the safety about who might be on the other end of that online conversation. And talking with parents about turning on tracking and keeping information private, and then talking to kids about what that privacy might look like. I grew up in an age where we didn't have social media, and I didn't have a mobile phone 24/7. I didn't have a mobile phone, period, growing up, because they weren't invented. But thinking about how we keep our information private and providing education about photos once we send them no longer being our personal property. And having open communication without blaming, shaming, or judgment. So now that we asked, what do we do? I always try to thank the youth for telling me about what they're doing and provide reassurance that we have a relationship as a healthcare provider and a patient, and I appreciate them telling me. I try to be calm and give them my full attention. I let kids tell me in their own words about what happened, and then talk about next steps, being open and honest about the steps that we need to take as healthcare clinicians, and about medical testing that we can do if there is a shared decision making that that's what we want to do in terms of things like sexually transmitted infections. And then I always am honest that by law in the United States, I am required to report this crime to the authorities, and I don't make any promises that I can't keep. I want to maintain a trusting relationship with the children that I serve. So our response to sextortion and trafficking should be evidence-based, working within our scope of education and training. I know that in the United States and other places there are reporting laws. We should know them and follow them, and making referrals to appropriate resources and offering those resources. We should try to be trauma informed, thinking about safety, choice. Patients should have control. We should be collaborative in the decision-making with our patient, and being trustworthy in terms of respecting our personal and professional boundaries, empowering. This is really hard for many of our clinicians that we talk with, because they want to rescue the patient, which is not our job. Our job is to communicate that the hospital setting or the clinical setting is a safe place, that what happened isn't your fault, and we're here to help you. And then ideally, we can try to be culturally responsive, thinking about our personal biases, identifying our own biases, and then using professional interpreter services, realizing and recognizing that there are cultural differences between healthcare clinicians, law enforcement, trafficked persons, youth who are sextorted, social services, or other disciplines involved in care. And ideally, we can advocate for an inclusive and representative team. And then more for you all in terms of the future, I put in a series of resources, some of which are local in Colorado, where I am based, and some of which are just on the internet. So these are here for y'all to look at your own time. But I put in a bunch of different resources. And then I'm happy at the end to talk about questions and concerns. I appreciate the time today.
Thank you, Denise. Great takeaway. People don't disclose because we don't ask. Certainly that ought to be the message that all of us hear. And to Jesse Foreman, who asked for your slides or a description about how to access them, but we'll make sure, Jesse, that you get those. So let's move on to our final panelist. I'm pleased to present Heather Taussig. Dr. Taussig is a clinical psychologist who holds joint appointments at the Kempe Center and the University of Denver's Graduate School of Social Work. While she's new to this area of research, Dr. Taussig has particular knowledge and perspective in the field of prevention. Her research is focused on developing and testing prevention programs, particularly for young people experiencing adversity and child welfare involvement. Among other things, she conducted a 10-year longitudinal study of youth in foster care. She developed and directs the Fostering Healthy Future program, serves on many national boards, and was honored by the International Society for the Prevention of Child Abuse and Neglect for her trailblazing research. She was also a Fulbright Scholar at Cardiff University in Wales. So, Heather, we've heard from the other panelists about the true nature and extent of the problem and the unique challenges. There seems to be consensus that the problem is large, underreported, underappreciated. What have you learned about what we need to do to prevent it, and about the scope of the problem for youth, in particular with child welfare involvement, and next steps in this line of research?
Thank you, Ernie. I'm honored to be part of this esteemed panel. And as Ernie said, I really am very new to this area of work, but I will share, and I'm going to try to run through the slides pretty quickly so that we have maybe a few minutes for questions for or input. Well, slides won't. There we go. As everyone knows, none of us who are presenting probably do this work in a vacuum, and I have so many people to thank, including our staff, funders, and primarily the children and families who do share their stories with us and engage in our clinical research endeavors. So this has been said by presenters before, although I'll specifically say that young people with child welfare involvement may be at particular risk for experiencing technology-facilitated abuse, given their prior experiences of maltreatment, a lot of caregiver instability, and maybe low caregiver monitoring, given lots of challenges within families. These young people have high rates of school expulsion and running away, and also high rates of mental illness and poor social skills, all of which have been associated for risk of experiencing human trafficking, as Denise was just talking about. I don't know of any, but I haven't done a thorough lit review, so want to learn from you all, of studies that have examined early correlates of later online victimization in a child welfare involved sample. And so this is a very exploratory investigation, hopefully, again, with important findings for prevention efforts. I'm going to talk about two studies today. The first is our Fostering Healthy Futures for Preteen studies, in which back in 2002, so well before young people were regularly on the internet, we enrolled 9 to 11-year-old children recently placed in any type of out-of-home care. We enrolled almost 600 over 10 years, and then we conducted randomized controlled trials of our Fostering Healthy Futures mentoring and skills group intervention with a subset of these young people. And then we conducted follow-up interviews at multiple time points, including young adulthood, and I'm going to share some data from young adulthood. In pre-adolescence, the children were an average age of 10, which, as we just heard, 10 may not even be early enough as we think about prevention efforts. When we interviewed them at a fifth wave of interviews, they were an average age of 20, about half were female. We had nice racial and ethnic distribution, with young people often identifying as belonging to more than one racial ethnic category. The types of maltreatment experience were coded at baseline from the legal petitions and the family social histories that led to their out-of-home placement. We also have self-reported maltreatment from young adulthood, and I'm not reporting on that here. But over 80% had documented neglect prior to being removed from their homes, about a quarter physical abuse, and a much lower percentage sexual abuse. So when we looked at, again, this was conducted back in 2014 to 2018, the young adult interviews. So lots and lots has changed. And my guess would be that these are really underestimates. Not so much because people may not have wanted to disclose, because they disclose a lot of information to us in these private interviews, and trust us, as it's a fifth wave of interviews, but because technology has changed so greatly. So we were able to follow up 88% of those eligible for this young adult study, and we asked the following question in young adulthood. In the last year, did someone send you sexual or naked photos of themselves through text or online that you did not want? And so again, I think in this day and age, we'd probably have a higher percentage reporting this. That's less important actually for the work that I'm thinking about doing in conjunction with Warren, Ernie, and others in looking at, again, what are early predictors and then prevention efforts. But you can see that more females than males, twice as many females, although the disparity isn't as great as in other studies that I've looked at. And 75% had experienced this more than once. So next steps are to be looking at information on the perpetrators and other maybe contextual factors around this. But I did look at early predictors of later victimization, being female, approach significance. You can see the p-value there. Being Black or African American was also a predictor within our sample. Again, all young people in this sample were removed from their homes at ages 9 to 11. Identifying as lesbian, gay, or bisexual in young adulthood was a statistical trend to being a predictor. Experiencing physical abuse. Again, we had lower percentage of those who experienced sexual abuse. There was maybe approaching, not as close significance for being sexually abused. The number of adverse childhood experiences among this already very high ACEs sample, given that they were all in foster care. But more adversity early on was predicted again, online victimization 10 years later. And if they'd ever been in therapy or received psych meds, they were also at greater risk. Importantly, also, there were things that were non-significant. So other racial ethnic groups didn't predict online victimization in young adulthood. Living with kin or in out of home, with non-relative foster parents, or even in congregate care did not predict. Reunifying with families of origin at some point did approach predicting more risk of online victimization, but aging out of care did not. Other maltreatment types, as I said, did not, although sexual abuse approached. Cognitive functioning did not predict, nor did graduating high school. We also have a Fostering Healthy Futures for Teens study, more recently completed. We enrolled 8th and 9th graders who had open child welfare cases. About half were living at home at baseline, a third living with kin, and the remainder in congregate care and non-relative foster care. This was slightly more recent study with follow-up 2.5 years post. So we have follow-up into 2020. So again, we'll have more recent data. We conducted a randomized controlled trial of an adapted Fostering Healthy Futures for Preteens program, and again, looked at mentoring that focused on goal setting and skills training, which I think is really maybe a ripe avenue for prevention efforts. In this study, average age was 14, about a little over half were female, again, good racial ethnic diversity, and about the same rates of types of maltreatment. So we interviewed again at baseline these 12 to 15-year-olds, and we asked 2 questions. The same one is from the preteen study. A slightly higher percentage reported experiencing this, with over 1 in 5 females reporting this, a much smaller percentage of males. And then one item from the juvenile victimization questionnaire. In the last year, did anyone on the internet ever ask you sexual questions about yourself or try to get you to talk online about sex when you did not want to talk about those things? 21% overall had experienced this, almost a third of females, and about 10% of males. 10.7% of the overall sample had experienced both of these online victimization experiences. Again, looking at, this is just cross-sectionally now, what predicted at baseline, having experienced both unwanted pictures on the left or the middle column, and then being asked unwanted sexual questions. So again, being female, 9th grade as compared to 8th graders, and so being older or in a higher grade was more predictive of being asked unwanted sexual questions. Sexual abuse on its own was a predictor of being asked unwanted sexual questions, but not of receiving unwanted pictures. Combining any type of abuse, sexual or physical, was a predictor for both. Again, community violence exposure shows up, ACEs. The one item on the full juvenile victimization questionnaire, which has multiple forms of victimization, was a predictor of receiving unwanted pictures. And then mental health and behavioral problems, as indexed both by self-report and caregiver or parent report at baseline, was also a predictor of both types of victimization. Again, no racial or ethnic groups were predictive. Being at home or versus living in out-of-home care did not predict these types of victimization, and other maltreatment types did not predict, although lack of supervision, that type of neglect, did approach statistical significance in predicting. So our next steps are to continue to examine modifiable early characteristics. Not all of these are modifiable, but that may be associated with victimization. And some things I'm particularly interested in relative to our mentoring and skills group intervention, where we try to connect young people with activities and social interactions that build on their strengths and interests. Maybe we are able to reduce the amount of time spent on social media and increase the amount of time spent in other activities. Maybe they're engaging with peers who are providing pressure for engaging in healthy behaviors as opposed to more negative and other health risk behaviors, which I imagine this co-varies with. Parental monitoring is tricky, but we will look at that because young people change homes and caregivers frequently when they have child welfare involvement. And I know we may not have time today because we only have 3 more minutes, but I am interested in other characteristics that folks maybe offline you could send in examining, especially in early predictors and modifiable. We're very interested in developing curricula related to the prevention of online victimization, but that would not be without the context of our full programming, which again is skills-based. I know I have about 3 more minutes of presentation, but Ernie, would you like me to wrap up so that we can have time for questions for others?
I think that would be great, Heather. I'm struck by the fact that perhaps the conventional wisdom is that kids in the foster system are not as vulnerable to this kind of abuse and exploitation. And your research seems to indicate that's not the case, that there is a vulnerability there that perhaps we've not recognized enough. So I think powerful data from your research, and I would ask if there are questions for Heather or Ethel or Denise as we move forward. Anybody?
Let me just say,
how much time do we have?
I think I have 1 minute, but I don't know if we have to end right at 12:14. I will say that I'm going to post my slides, which also talk about our intervention. And again, targets that we're going to be looking at in terms of skills training, positive youth development, which is really this framework. So I will stop sharing in case we do have time for questions.
Okay. Are there any questions from the audience? As you can see, there's and we've been asked to post your questions. A quick question for Ethel. When in your opening, you indicated a greater focus on or some differences from Dr. Finkelhor's research, which I know was U.S.-based research. Are there specific areas that you think require more attention, both nationally and internationally?
Unmute myself, and I've stopped coughing, so my apologies for that. I think the most recent survey data that they have is really interesting, and it does very much point to the fact that, you know, a lot of the offending relates to people who are known to you already, and clearly romantic relationships, early sexual relationships play a large part in that. I think what we don't see, though, because they're not always reported, is that if you look at other kinds of data, for example, if you look at chat log data, if you look at some of the seized data from law enforcement, you will also see that there are other offences that take place in this space, particularly in terms of online grooming, that are of slightly younger children, and also that do not necessarily kind of relate to peer-related violence. And I think one of the critical things there that I think I would differ with from David in relation to this is the assumption being that these relationships, these online grooming relationships, look identical, look very similar to romantic relationships that you may see amongst adults. I have not seen that many relationships that take place between adults where the opening line is age, sex, location, or do you want to do X, Y, and Z sexual activity? So I think there are, just as I think David was arguing that there are complexities in this area in terms of how we position these cases, I think there are additional complexities in terms of what we may understand and some of the challenges faced by different kinds of data.
Yeah, I think that's important. And as we focus on a broader, longer term research agenda, that's clearly an area in which we need to zero in. We have a question from Elizabeth Brown to everyone. Children who have had prior experiences of abuse and neglect be subjected to child trafficking and other exploitation more likely than the children who have not been exposed to abuse and neglect. Denise, let's start with you. Any thoughts on that?
When we talk about high-risk youth, children who have involvement within the child welfare system, at least in the United States, are oftentimes considered to be part of that high-risk youth population. I'm not sure that we have ideal data or great data to support that, but that is anecdotally what we surmise.
Okay. Heather, any comments on that?
Not additionally. I did have a reference in my presentation on that from ACF. So as Denise said, I think, again, they have a constellation of risk factors that do place them at greater risk.
And we have a question from Dr. Finkelhor. A problem with police and NCMEC data about images is that images of teens can't be distinguished from legal images of adults. Ethel, any thoughts on that?
I absolutely agree, although I think the police data, certainly the police data that we have had access to, has been of identified children. So where children have been identified from the images themselves, which is slightly different data. I absolutely agree that once you start to move into post-puberty, it is very, very, very difficult to differentiate somebody who may be under the age of 18 from somebody who's just over the age of 18. And I don't think we have a resolution to that. And I don't think even our AI scanners provide an absolute resolution for that either. So I would agree with them. It is not without its challenges.
Okay, Denise, I saw you nodding your head. You want to comment on that?
So it's not infrequent that we get asked to review pornographic images to try to determine if they are child or adolescents. And, when I started my career, it was much easier to do that. And it is near impossible to do that at this point with how good the technology is around photo images and also modifying those images. Most of what I have to look at, I say, is indeterminate. I can't say, which is really dissatisfying.
Okay. Heather, any thoughts on that point?
Sorry, no, I shook my head.
Okay. All right. And David adds, this is why teens are underrepresented in data based on intercepted images. And clearly one of the challenges, and I suspect, Denise, this is particularly a challenge in the human trafficking space as well, is purely victim identification. I know as we looked at reports at the National Center of Online Exploitation of Children and in other entities, the biggest challenge is simply placing that child somewhere on planet Earth and identifying who they are so they can be rescued and their perpetrator identified. So victim identification remains a huge challenge. Other questions? Or other comments? Heather, I feel like I cut you off a little bit there at the end. Any other key points you want to make while we have a minute?
No, I'm really, thinking a lot about how, again, in prevention programming, so not intervention necessarily or preventing recurrence, we both need to do sort of basic education and information sharing, and then how that probably isn't enough, right? That it's going to need to be, paired with other types of prevention programming that are more holistic in nature, not just focusing on this. So that's an area that I'm really interested to dive into more deeply. And again, would welcome all suggestions from folks as we think about how to embed online victimization prevention within a broader prevention effort for vulnerable young people.
Great.
Heather, I think that that's a really interesting topic. And I would add that we need to think about screening, at least in healthcare facilities, but also there's so much screening fatigue when you look at the number of screeners that we're asked to do, for instance, in a pediatric emergency department, and how we can embed quickly a few questions to help with identification of just high risk behaviors, and then think about how we can support from there.
I think that, particularly for this audience and this conference, that's really a key issue. And I know, Denise, it's something you've really worked on. So how, if people don't disclose because we don't ask, what are the questions we need to ask that maximize the likelihood that we're going to identify the abuse? Warren, we've run over. Do you have any questions you want to add, or?
No, I simply would like to thank you, Arnie, for moderating this fascinating discussion today, and to all of our panelists for sharing their knowledge and their expertise. I want to remind those who are attending that we have several more programs today related to online child safety, 21st century forms of child abuse. Next up, in about an hour and 25 minutes, you'll have the chance to hear Dr. Ernesto Caffo look at this within the larger context of the history of our understanding and framing of child abuse, followed by a panel of tech experts whom you can ask some of the questions that you have about their efforts to create safer platforms for children. So we will see you all soon, hopefully at our next session. And thank you again to Ernie and the panelists for this wonderful discussion.